Basil, Ocimum basilicum, is a green leafy herb that belongs to the mint family. It has a sweet and aromatic flavor and is widely used in cuisines around the world, especially in Italian dishes like pesto and pizza. Basil is not only a tasty herb, it's also a natural remedy for many health problems. Basil contains various compounds that have anti-inflammatory, antioxidant, antibacterial, antiviral, and antifungal properties. Basil can help you fight infections. Basil has been shown to inhibit the growth of bacteria such as Staphylococcus aureus, Escherichia coli, Salmonella typhi, and Helicobacter pylori. It can also prevent viral infections such as herpes simplex virus type 1 and type 2. Moreover, basil can boost your immune system by stimulating the production of antibodies. Basil can help you reduce stress and anxiety. Basil has a calming effect on your nervous system and can help you cope with stress and anxiety. A study published in 2014 in the Journal of Ayurveda and Integrative Medicine found that basil extract significantly reduced stress levels, anxiety, and depression in healthy volunteers. Basil can also improve your mood and cognitive function by increasing the levels of serotonin and dopamine in your brain. Basil can help you lower your blood sugar levels. Basil can improve your insulin sensitivity and glucose metabolism, which can help you control your blood sugar levels. A study published in 2012 in the Journal of Ethnopharmacology found that basil extract lowered fasting blood glucose levels and improved lipid profile in diabetic rats. Basil can also prevent oxidative damage caused by high blood sugar levels. Basil can help you protect your heart health. Basil can lower your blood pressure and cholesterol levels, which can reduce your risk of cardiovascular diseases. A study published in 2016 in the Journal of Dietary Supplements found that basil extract lowered systolic and diastolic blood pressure and total cholesterol levels in hypertensive patients. Basil can also prevent blood clots and improve blood circulation by inhibiting platelet aggregation. Basil can help you improve your digestion. Basil can stimulate the secretion of digestive enzymes and bile, which can help you break down food and absorb nutrients. Basil can also relieve digestive disorders such as indigestion, nausea, vomiting, gas, bloating, constipation, and diarrhea. Basil can also protect your stomach lining from ulcers by inhibiting the activity of Helicobacter pylori. Basil can help you enhance your skin health. Basil can nourish your skin with vitamins A, C, E, K, and B complex, as well as minerals like calcium, iron, magnesium, potassium, zinc, and selenium. Basil can also fight acne by killing bacteria and reducing inflammation. Basil can also heal wounds by promoting blood clotting and preventing infection. Basil can help you maintain your hair health. Basil can strengthen your hair follicles and prevent hair loss by improving blood circulation to your scalp. Basil can also moisturize your hair and scalp by balancing the oil production. Basil can also treat dandruff by eliminating fungus and soothing itchiness. Basil can help you boost your bone health. Basil is rich in calcium, which is essential for building strong bones and preventing osteoporosis. Basil also contains vitamin K, which helps calcium absorption and bone mineralization. Basil also contains magnesium, which regulates calcium transport and activates enzymes involved in bone formation. Basil can help you support your liver health. Basil can detoxify your liver by stimulating the production of glutathione, which is a powerful antioxidant that neutralizes toxins. Basil can also protect your liver from damage caused by alcohol or drugs by reducing oxidative stress and inflammation. Basil can help you prevent kidney stones. Basil can prevent the formation of kidney stones by increasing urine output and reducing uric acid levels. Basil can also dissolve existing kidney stones by breaking down calcium oxalate crystals. Liver damage. Basil contains a chemical called eugenol, which can be toxic to the liver if consumed in excess. Eugenol can cause liver inflammation, bleeding, and jaundice. People with liver disease or taking medications that affect the liver should avoid or limit basil intake. Bleeding disorders. Basil can slow blood clotting and increase the risk of bleeding in people with bleeding disorders or who are taking blood-thinning medications. Basil can also interact with some herbs and supplements that have similar effects, such as garlic, ginger, ginkgo, and turmeric. People with bleeding disorders or who are scheduled for surgery should avoid or limit basil intake. Low blood sugar. Basil can lower blood sugar levels and affect the control of diabetes. Basil can also interact with some medications that lower blood sugar, such as insulin, metformin, and glipizide. People with diabetes or hypoglycemia should monitor their blood sugar levels closely and adjust their medication dosage if needed when consuming basil. Low blood pressure. Basil can lower blood pressure and affect the control of hypertension. Basil can also interact with some medications that lower blood pressure, such as beta blockers, calcium channel blockers, and diuretics. People with low blood pressure or taking antihypertensive medications should monitor their blood pressure levels closely and consult their doctor before consuming basil. Hormonal effects. Basil can affect the levels of hormones in the body, such as estrogen and testosterone. Basil can also interfere with some hormonal medications, such as birth control pills, hormone replacement therapy, and tamoxifen. People with hormonal conditions or taking hormonal medications should be cautious when consuming basil. Allergic reactions. Basil can cause allergic reactions in some people, such as skin rashes, itching, swelling, and difficulty breathing. People who are allergic to basil or other plants in the mint family, such as oregano, thyme, and sage, should avoid basil. Gastrointestinal problems. Basil can cause gastrointestinal problems in some people, such as nausea, vomiting, diarrhea, and abdominal pain. People who have sensitive stomachs or digestive disorders should avoid or limit basil intake. These are some of the possible side effects of consuming basil. However, these side effects are rare and usually occur only when basil is consumed in large amounts or for a long time. For most people, consuming basil in moderate amounts as part of a balanced diet is safe and beneficial. If you have any medical conditions or take any medications, you should consult your doctor before consuming basil. You should also stop consuming basil and seek medical attention if you experience any adverse reactions. This is the recipe for basil pesto. Ingredients: 1 cup fresh basil leaves, 1/4 cup pine nuts, 1/4 cup grated Parmesan cheese, 2 cloves garlic, minced, 1/4 cup olive oil, salt and pepper to taste. Combine all ingredients in a food processor and pulse until smooth. Taste and adjust seasonings as desired. Serve with pasta, bread, or vegetables. Tips: for a smoother pesto, use toasted pine nuts. If you don't have a food processor, you can chop the basil leaves and pine nuts finely by hand. You can also add other ingredients to your pesto, such as lemon juice, red pepper flakes, or roasted vegetables. Basil pesto is a good source of fiber, which can help to improve digestion. It is also a good source of antioxidants, which can help to protect the digestive system from damage.